talking about coping strategies and emotional adjustment for pediatric patients and their caregivers after solid organ transplant. We'll also be discussing effective strategies for enhancing the mental well-being of families post-transplant. I'm Dr. Lauren Esposito, and I'm a pediatric psychologist on the kidney transplant and dialysis teams at Children's Healthcare of Atlanta and Emory University School of Medicine. I'm going to start us off by discussing the patient experience following pediatric solid organ transplant, and I'm also joined by my colleagues today, Dr. Courtney Smith and Dr. Kristen Neal. Pediatric solid organ transplantation is an increasingly successful treatment for organ failure. Advancements in medicine and surgical techniques over the past couple of decades have resulted in improved patient survival rates, with over 80% of pediatric patients surviving into adolescence and young adulthood. However, transplant is not curative. Instead, a fatal disease is replaced by a chronic condition with its own associated medical risks and clinical complexities. As so many of you already know, patients have significant follow-up care after their transplant, including, but certainly not limited to, regular medical appointments and blood draws, daily medications that need to be taken on a specific schedule, possible activity restrictions, nutrition and growth considerations, and/or additional surgical interventions. Given these ongoing care needs, it's important to recognize that many children and adolescents will struggle at some point and may benefit from additional support or psychological intervention. So what does adjustment to life after transplant look like? I'm going to start us off by discussing themes commonly shared by many of our pediatric patients. Although they may initially seem alarming, these symptoms are fairly common and present for many patients at one point or another. It's very normal to have an adjustment period with changing emotions and needs over time. Many children and adolescents will experience frustration due to the frequent interruptions to their daily life. This often stems from the frequency of clinic appointments and time commuting to and from the hospital, regular lab draws, and a high number of medications and strict medication schedules. I've seen patients become particularly frustrated when it feels as though they are missing out on important life events such as school, sporting events, school dances, or social gatherings. I've also had many patients expect transplant to be a magic fix that makes everything in life easier or better. And while transplant can certainly help in some areas, it doesn't magically cure everything or pave the way for a fully normal life without additional considerations. Part of our job as psychologists is to best prepare children for transplant by helping them develop a realistic view of transplant and life post-transplant, including some of the uncertainties or possible challenges. Many transplant recipients don't outwardly look different from their peers, which means most people have no idea they have a transplant unless they specifically choose to share that information. Patients have shared sentiments that their peers will never fully understand their experience or what it's like to wait for and now care for a transplanted organ. Along these same lines, it's normal for some children, especially teenagers, to choose to keep their medical history private due to desire to not be seen as different or to not focus on a particularly stressful time. Relatedly, I've had many adolescents tell me they're embarrassed to take medications in front of peers due to questions that they may receive or jokes that might be made. It's helpful when kids and adolescents have some control or say in how much information is shared and who specifically it's shared with. I often encourage our patients to think up a response ahead of time if peers ask questions about why they were out of school or why they have to take their medications. That way, they're not caught off guard or stuck in an uncomfortable situation. Lastly, it's not uncommon to have periods of time in which patients disengage from medical providers. This can occur for a range of reasons, and while some are cause for concern, others can just be the patient's way of having some control over an otherwise very uncontrollable situation. This does, however, become more concerning if it does not improve from time to time, especially as kids are getting older. Now I want to go over some signs to look out for that indicate greater concern and a need for further follow-up. I'll focus more on the signs to look out for, and then later on, Dr. and Kristen Neal will discuss specific recommendations or resources. First, emotions and behaviors become more concerning when they interfere with the necessary medical or everyday tasks. For example, if patients refuse to come to clinic or experience significant distress during lab draws or appointments that lingers even after that appointment is over. This may be indicative of post-traumatic stress. Additionally, symptoms of anxiety or depression that impact sleep, appetite, or engagement with school or peers is often concerning. This would want further assessment and potentially intervention. Poor medication adherence, often flagged by lab results or caregivers discovering that children are not taking medication as prescribed, is also very concerning given the risk for organ rejection or other health problems. There may be times in which children hide medication, forget to take their medication, lie about adherence, or just don't have a great understanding of their medications and when to take them. Medical and/or mental health providers can be especially helpful in determining the cause of non-adherence and provide appropriate intervention based on that cause. Risk-taking behaviors such as alcohol or drug use, other unsafe behaviors, or impulsivity are concerning for any child or adolescent. However, these behaviors are particularly concerning for individuals with chronic health conditions such as transplant, because they can affect medication adherence, hydration, and other health behaviors. Sometimes risky behaviors are used as a way to avoid or attempt to cope with difficult emotions or trauma. Therapy can be helpful for processing these emotions and teaching more adaptive coping strategies. Earlier, I had mentioned disengagement can be very normal from time to time. However, if you notice that your child or teen is withdrawing from the people that they're closest to, such as family, friends, or teachers, that's of much greater concern and may indicate additional struggles worth following up on. Lastly, anytime you have concerns regarding self-injurious behavior or suicidal ideation, it's important that you follow up with a mental health care provider for additional support to ensure we're keeping your child supported and safe. Again, Dr. Neal will speak more in detail about how to access resources a little bit later on. So what we know about trauma is that people can have very different psychological responses to similar events. Some individuals may experience post-traumatic stress or even meet criteria for post-traumatic stress disorder, PTSD for short. PTSD is characterized by a range of symptoms that can significantly impair an individual's functioning and quality of life. In contrast, post-traumatic growth refers to the phenomenon in which individuals experience positive psychological changes as a result of dealing with and adapting to the traumatic event. Both of these trauma responses are complex and multifaceted, and it is possible to experience both post-traumatic stress and post-traumatic growth at some point during their journey. All of this to say, although transplant can be challenging and requires lifelong care, many children and adolescents who undergo transplant do go on to report post-traumatic growth and greater appreciation for life. Individuals have also reported gaining new relationships or life goals as a result of their health journey. For instance, children may make new friendships through transplant camps or hospital-based activities. Families may meet other families who have experienced similar medical journeys. Families have also commented on their close relationships with members of their child's medical team. Further, many patients have discussed goals of working towards a career in medicine or other helping professions in order to give back and help others in the same way that they received help, or they've noticed gaps where they wish they had received more help. Lastly, research actually suggests that adults who received solid organ transplants in childhood have similar quality of life and psychological functioning compared to the general population. Of note, the majority of research does suggest that transplant recipients had poor physical functioning given their health history. And then there were some mixed results regarding social functioning. Now I'm going to hand it over to Dr. Courtney Smith, who will discuss more of the caregiver experience.
Thank you, Dr. Esposito. I'm Courtney Smith, and I'm the heart and kidney transplant psychologist at the University of Louisville School of Medicine and Norton Children's Hospital. I feel honored to get to speak to y'all today. We're going to shift gears a little bit to talk about the adjustment of people who love and care for pediatric transplant recipients. For those of you in the audience who are parents or caregivers, I recognize that I'm preaching to the choir and that I haven't walked in your shoes. I also want to say that I owe so much of my learning and what I'll be sharing today to the parents and caregivers I work with day in and day out, who trust me enough to share their experiences with me. As we look into the literature, we find that most data gathered about caregiver adjustment is focused on pre-transplant and the early years after surgery. So information about caregiver experiences a year or more post-transplant is a little bit more sparse. Even so, one helpful article reviewed 21 studies focused on caregiver adjustment to life after transplant and identified a list of common themes. In terms of universal themes, parents and caregivers also often find that transplant does not mark the end of the journey, but the start of a new one. Receiving the call that a long-awaited organ has become available for your child brings about a most dramatic range of feelings, from shock and worry to relief and gratitude, and there's a sense that it's the culmination or ending of what everyone's been waiting for and hoping for. In reality, however, families soon find that it marks an ending and a beginning at the same time. One of the things we hear from and talk to our caregivers about is how transplant can feel as though they're trading one really challenging set of medical circumstances for a different, really challenging set of medical circumstances, and that this continues down the years. Another theme is how caregiver fear about their child's survival shifts from fear to fear about infection, rejection, the future, etc. And there are, of course, ongoing care demands, clinic visits, medications to administer and refill, lab draws, developmental therapies, etc. And interlaced with all of this is a striving for normalcy and balance, returning to school and work, refocusing on sibling needs, allowing the child who received a transplant to be a kid, parental self-care, couple self-care, and so on. I know that many of you know the weight of all of this. The research tells us that there are factors that may hinder caregiver adjustment over time and factors that may facilitate or promote caregiver adjustment over time. Factors that have been found to hinder caregiver adjustment include, first, high levels of uncertainty, anxiety, and stress. Studies indicate that caregiver stress can be associated with lower quality of life for our pediatric transplant recipients. Further, untreated parental mental health issues, including substance abuse, may impact medication adherence for children and teens. Certainly, it's absolutely the norm and 100% valid for caregivers to feel worried and stressed and anxious and even depressed. And it's critical that caregivers have access to supports and tools which will help with de-stressing and managing their worries and anxieties. And some ideas about this are forthcoming. The second factor that has been found to hinder caregiver adjustment is follow-up healthcare requirements. In keeping with this same theme, there's a reason why we ensure that there's more than one person available to help during post-transplant care, and that's because it's a lot and ongoing. People want to help. Our advice would be to let them. A relative or family friend might be perfectly capable of taking a child or teen to a therapy appointment or picking up prescriptions. Next, we have the possibility of poor communication and difficult interactions with medical providers. There's a lot of research indicating that the relationship you have with your children's medical providers goes a long way towards best outcomes for everyone. Even though a year or more has passed since transplant, there's still time for more positive relationships to be built. And even though it may be difficult to diplomatically address your concerns with a particular provider or providers, not doing this will take more energy and weigh heavier on everyone as time goes by. The fourth and fifth factors that may hinder caregiver adjustment are lacking of ongoing support and feeling isolated. Being at this conference and a part of transplant families is a perfect example of one way to address feeling isolated and a lack of support. The education and camaraderie provided through groups such as this one will go a long way towards managing feeling vulnerable and unprepared at every transplant stage. And it's never too late. You're never too far along in your transplant caregiving journey to seek help from others. Dr. Neal, our next speaker, will be providing some additional resources and suggestions regarding this. Finally, feeling vulnerable and unprepared, while these feelings may feel more relevant to the pre-transplant and just after transplant time periods, they can rear their heads over and over again, both in general and when post-transplant illnesses and other concerns pop up. I'm going to lean into the age-old adage that there's never a silly question. The post-transplant road may not always feel straightforward, and it's always okay to ask questions of your team. As we move to discuss those factors in the literature that have been shown to facilitate caregiver adjustment, common sense would tell us that it's pretty much the opposite of what hinders caregiver adjustment. First, information, education, and feeling prepared. As I was just saying a second ago, being more than a year past your child's transplant doesn't mean that questions won't arise. Even though caregivers practically earn their nursing and medical degrees somewhere along the way while taking care of their kids, the fact is that most of us are not transplant nurses or physicians. And new phases of transplant also bring about new questions. Navigating the teenage years, transitioning to adult care. There arise horizons ahead that your team has already guided others through. You have permission to be a lifelong learner. Second, and as I said earlier, we'll be seeing some more about resources on available support and resources in just a minute. Research has demonstrated that greater social support post-transplant has been directly related to parent and family well-being. Two other factors that facilitate caregiver adjustment include focusing on positives and trying to live in the moment. I once worked with a foster parent who took care of medically fragile children, and she told me that rather than making her list of things to do at the beginning of the day, she would write down all that she did at the end of the day and cross each of them off. I rather liked her way of focusing on the positives. In all seriousness, there's plenty of research that shows us how mindfully focusing on things that are going well and just the moment in front of us can serve to boost our moods and overall adjustment and reduce our anxieties. Related to this, it's also important for caregivers to monitor when in-person and online support groups feel helpful to them and when it's too much to ride other people's roller coasters along with them. It's okay to move in and out of these groups in whatever way that serves you best. Finally, we know there's the potential for many positive changes resulting from transplant. We know that transplant most often improves health and quality of life for children, caregivers, and families. While it can be challenging, establishing a new normal can also be extremely gratifying, though it may take time, and the definition of a new normal and what this looks like may have many iterations. There's data that positive changes in how caregivers relate to themselves and others may occur. There may be positive shifts in what feels important in life and what just doesn't. There may be shifts in what people choose to spend time on and what they don't. Most caregivers report that by establishing new routines and a new normal, the process gets easier over time. Finally, and as noted earlier by Dr. Esposito when talking about transplant recipients, there can be what we call significant post-traumatic growth for caregivers as well. While this can take many forms, one thing I hear about often is caregivers who engage in meaning making around their child's health challenges and transplant. For example, valuing time with their children in a different way, marveling at their children's resilience, putting other stressors into new perspective, and being grateful for the small things that are really the big things. Now I'm going to turn it over to Dr. Kristen Neal.
Thank you, Dr. Smith. I'm Kristen Neal. I am the heart transplant psychologist at Children's Healthcare of Atlanta and Emory School of Medicine. I'm going to do my best, after I've been hyped up by both of my colleagues today, to give you some ideas about how to find the support that we're telling you that would be best for you. I think the best first step is to go to your team. We are aware that not every transplant team has a psychologist, but every single transplant team should have a social worker, and they might be your best step to ask for mental health professionals who they've worked with in the past and can refer you to. If there is a psychologist on your team, of course, that would also be a best first step. We also encourage you to explore online support groups. These might be at your children's hospital or national or international support groups that have support for families who are experiencing the same transplant journey. And then we also really encourage you to identify local resources. So often there are providers in the community who have seen other transplant patients and have experience working with that population. This is another area where you might be able to lean on your transplant medical team, where you may be able to lean on your transplant medical team to get ideas about what organizations exist in your area. This may also include like summer camps and things that are put on by your transplant organization. I also want to take some time to look at different ways to access and identify resources if your transplant team or your children's hospital doesn't have an established list of referrals. Psychology Today is one of the world's largest portals for identifying therapists. It is a website. It includes free access to listings of hundreds of thousands of professionals, and you're able to sort by location, by state, by insurance coverage, by specialty and age group, and it's a really wonderful resource to find providers available in your area. While I give the caveat that Ollie's branch is specific to our heart transplant patients, it's a wonderful example of a resource that is available to try to meet the need of mental health care in our transplant population. So Ollie's branch is a mental health program that is funded by the Ollie Hinkle Heart Foundation, and it offers 8 free therapy sessions to anyone within a Heart Warrior family. So this could be the child themselves, their siblings, parents, grandparents, or even their providers. Ollie's branch has many agreements with different children's hospitals across the country, including Seattle, Lucille Packard, Rady, Children's Colorado, Children's Mercy, St. Louis, Cardinal Glennon, Lurie, Children's Healthcare of Atlanta, Wolfson Children's, Rainbow Babies, CHOP, Children's National, and Boston Children's. And you are able to go to this link if you didn't hear your children's hospital where you are currently being treated named along that list. You're able to reach out to the Ollie's branch and ask for them to make that connection with your children's hospital. So as I gave the caveat at the beginning, I do know this is only for our heart transplant children, but this is a wonderful resource and I think a really great model to advocate for in your children's area. I also encourage you, obviously you know about transplant families, you're here today, but there are a lot of transplant organizations that we would encourage you to reach out to if you're looking for resources for support for yourself or for your child or any other member of your family. We have many of them listed here, including the Pediatric Transplant Association, the Children's Organ Transplant Association, and then other more specialized groups like the Pediatric Heart Transplant Society, Society of Pediatric Liver Transplant, and the Society of Pediatric Psychology. All of these groups have a specific focus on research, advocacy, and improving care for children needing transplants and living with chronic illness. I think it's also important to discuss what to ask when you identify a provider. So if you've gone on Psychology Today and identified someone who seems like they would be a good fit, it's still really important to talk to them about the care that they're able to provide. So either in your intake phone call with that therapist or in your first session, I think it's important to consider asking whether they have past experience working with patients and families living with chronic illness, whether they have experience working with acute or traumatic stress or health stress or major life disruptions. I think it's also appropriate to ask them about their theory of practice. And what I mean by this is how they approach therapy. Do they provide cognitive behavioral therapy? For our little kiddos, do they provide play therapy? How do they approach this, and how does that feel like it fits with your family's lifestyle? We have heard in preparation for this talk that a lot of patients and families who have spent much time in the hospital during transplant, leading up to transplant, and post-transplant, if you are lucky enough to have a psychologist on your team, that sometimes when they get discharged, their mental health coverage has been completely used up by the psychology visits that they had when they were in the hospital. If this is the case, I think it's really important to know then how to access outpatient care and have your health insurance cover it. If a therapy provider does accept health insurance, you could ask them to consider using health and behavior codes. Without getting too far into the weeds, psychologists use things called psychotherapy codes and health and behavior codes. Psychotherapy codes might be the ones that were used when they were in the hospital, and there are fewer of those that many health insurance companies will pay for, whereas health and behavior codes are more often paid for longer by health insurance companies. And this is just a psychologist providing psychotherapy with the medical diagnosis as they identify diagnosis that they're billing for. So it's important that you would ask if that's a possibility. I also want to recognize that a lot of outpatient psychologists and therapists are not billing insurance. It doesn't seem feasible for them or for their business model, and they do require you to pay out of pocket. If this is the case, but you do have mental health coverage under your insurance plan, I would ask that provider if they can give you a super bill so that you could submit that for reimbursement with your provider, with your insurance plan at the end of each month. I also wanted to kind of end my part here with a call to action. We have spent the last several minutes telling you why mental health support is important for your child and for your family, but I also know that it's really hard to find in a lot of places. We know that there are major gaps in the American healthcare system, especially when it comes to child mental health. So, some ways that we could try to advocate to fill this gap are first and foremost talking to your transplant team about why don't you have a psychologist on your team? We think it would be really helpful, and advocating for that. If I've learned anything from all of my years in working in academic medicine, it's the voice of the families that get things done. No matter how many times maybe the people on your team have wanted a psychologist, if there are many families that come together and request this, then it's more likely to happen. I think it's also really important to join family advisory councils so that you can talk with others about how they were maybe able to fill gaps that they had at their institutions or in their areas, and connecting with advocacy groups and taking any opportunity that you can to share your story with state leaders. So I know that there's Congenital Heart Disease Day every year at the Georgia State Capitol, and oftentimes our Heart Center goes there and talks to local legislatures about what we think would be best for our kids with heart disease. This is an opportunity for you to really advocate for care in your state. Along those lines, Dr. Esposito is going to close us out today with a very wonderful example of a family who did just that.
Yeah, so what better way to conclude our talk today than to highlight an example of a transplant family using their voice to advocate for patient needs and provide support for families going through dialysis and transplant. So briefly, after experiencing the struggles of dialysis firsthand and the hope offered by a life-saving transplant from her soccer coach, Gia and her mother, Rayanne, started One Kid, One Kidney to guide and support other families navigating dialysis and transplant. Their organization assists families searching for kidney donors, provides peer support, offers financial guidance and resources, as well as educational resources, advocacy, and awareness. And while One Kid, One Kidney started local at Children's Healthcare of Atlanta, the family hopes to grow it across the country. Their overall goal is to support families during their toughest moments so that those families can then support other families going through similar experiences in the future. They hope to just continue to grow and grow and grow. This is just one example of the incredible work led by patient families. So thank you so much for taking the time to listen today. And now we'd like to open it up for questions.
Hello, everyone, and welcome today. Thank you for joining us. We are so excited to have our panel today. Thank you all for being with us. We have some great questions already in the Q&A. I will go ahead and start asking, and whoever wants to respond, please take the questions. I'll start off with our first question, which is, why do so many families say the emotional hard work actually starts after transplant?
Who wants to take this? Go for it, Britt.
Maybe we can all say something. I feel like one of my thoughts is that people are sort of still maybe a little bit stunned, maybe a little deer in the headlights, pre-transplant, just trying to get through the workup, trying to make sure they get all of those evaluations done, and they're just in this doing mode. And then I think the hard work begins then, actually. And then I think, but I think there's just so much going on at the time, and it's so stressful that then once the transplant has gone and hopefully gone well, then maybe a lot of that just begins to unfold even more intensely. But I personally think it's the whole way through. I just think sometimes the beginning is people are just kind of stunned maybe by what they've got ahead, especially if it's a new situation that they weren't anticipating coming up for their child. And Dr. Neal and Esposito might have some other thoughts about that.
No, I agree. I think a lot of it is that checklist beforehand. There's so many things to do and check off. And as psychologists, part of our role, hopefully, is getting involved before transplant so that we can start these conversations and start these coping skills and all of that. I don't think that we're fully there just yet, though.
Yeah, I think especially for the kiddos who are transplanted, like in infancy and really early childhood, parents are obviously really focused on saving their lives and sustaining their lives. And then as they move through school age and adolescence, and all of the work of coming to appointments and taking their medications, and especially in the adolescent period, like developmentally, they're supposed to be not doing what we tell them to do. But in the case of transplant, that can become a life or death situation if they're not taking their medications. So I think that is really difficult for families to navigate, and it's a lot of emotional and time intensive work.
I can definitely identify with that question. I know that we had kind of care, and you guys were so concierge and helped us through the whole journey when we were in the hospital. And then you just try to get through day by day. And then by the time that year ran up, you're like, what just happened? So that's just a great explanation. I thank you all for answering that and helping us through. And they can reach out to you even after the initial transplant. Then they can ask for a psychologist at any time, correct?
Mm-hmm.
That's amazing. I'm going to direct this next question. How do you talk to your child about their donor in a healthy way? We'll go with Kristen first.
Well, I think it does. I think I saw in the chat, it does depend on the developmental age of the kiddo when they're asking. And so using language that's appropriate to how old they are when they're asking. And I think we try to frame it as, we all hear it's a gift, that a family made a really difficult decision when they lost a loved one to decide to donate life. And we may never know what happened. We may never know who that family is, but there are programs where we can send a letter and reach out and see if that family wants to connect. And I think some families really find that incredibly helpful and powerful. Other families don't want to do that. But I think just being clear, and even though it's kind of scary to use the word death with little kids, I think it's important to make sure that we do use that word, and that they know that someone died, but that you got to use this organ and it helped you live if it's not a living organ donor. And I guess I only do heart, so all of our donors are not living. Maybe I could pass off to Dr. Esposito or Dr. Smith for the living donor organs.
Go ahead, Dr. Esposito.
I think Kristen's explanation was wonderful. A lot of our kidney patients, I mean, we have deceased donors, so I would agree with everything that Kristen shared for that. But a lot of our kids who have living donors, they often know their donor. It's a parent or a loved one or somebody from the community that has stepped up. So I think conversations look very different and can kind of vary over time of why that person chose to donate their kidney. So I think a lot of times kids know that ahead of time.
I would agree. I don't have a lot more to add. I do both heart and kidney, and certainly those conversations, like Dr. Neal said, would be developmentally appropriate and done in a way and a time where everyone can kind of be together and be able to focus for a few minutes on it. There's so many moving parts and things going on, and picking that right time may be difficult, but I think kids do better when secrets about things are not kept, but that they're told in an age appropriate way. They're going to overhear things. They're going to, a lot of times, what they don't know or what is left a mystery to them is scarier than reality. But I know even as a mom myself, sometimes telling the truth or telling the real information is difficult. Still, I think it's important because I think they'll find out eventually.
That's great. I'm going to pitch one of our fellow nonprofits, the Chris Klug Foundation. They have a program through Donor Dudes that has age appropriate ways to share your donor story or your transplant story with all ages of the elementary school and junior high and high school. So go check them out. They have some good resources there too, because you're right, this is very difficult at any age. So that's great insight. All right, our next question. How do you handle transplant anniversary anxiety or medical PTSD? I'm going to pick on Dr. Esposito next.
Yeah, I think this is a big one that comes up, especially as kids get older and start to recognize dates or understand more about what all they've gone through. A lot of it's going to be exposure and talking about these topics and really processing the things that they've been through, following their lead to a degree. We've had kids that are ready to talk about it right away, and others that take a year or two to really want to dive into all of the details. But I think as psychologists and families, our job is really to open those conversations and kind of like Dr. Smith was just saying, of not hiding information and following the child's lead, answering their questions, and really giving them that space to explore all they've been through, and then slowly starting to process all of that and talk about the details that are tough.
That makes sense. Could I expand it to caregiver, also anxiety and medical PTSD? Dr. Smith, would you like to take
Yeah,
that?
I'd be glad to. I think that was a little bit in my presentation, but we actually began talking about medical PTSD at the pre-transplant eval and even sooner if I know the family before that. We do know that the research shows that parents have probably even a higher degree, even in some cases, of medical traumatic stress that often goes unnoticed by those of us as providers. So I try to ask parents as well about how they're doing with all of the exposure to medical procedures and events and things that they're observing their child go through. But I think, we do try to, I don't want to say normalize it like it's fine and okay, but try to help families and children understand that that's a common experience and then work with them on coping skills for managing that, for when they know kind of what their triggers might be or different things. I mean, I've even had a mom tell me that a certain route to the hospital was very, traumatic for her because things happened en route. And so there's just kind of planning for that really and thinking through it. And I want to back up to the transplant anniversaries too, because we've recently started celebrating those, and others, you guys may do that at your facilities too. But we've recently started having kind of a celebration at that time for each patient at their clinic appointment. And there's a big poster, and there's gifts, and then there's if you want to be on Instagram, on the Instagram page, it's my 1 year anniversary, it's my 2 year anniversary. So there's also kind of celebrating those milestones in addition to understanding that those may bring back challenges and traumatic memories and thoughts as well. So kind of acknowledging both, I'd say, is important.
Thank you. That was a great answer. All right, our next question. What does reintegrating into normal life look like emotionally for kids post-transplant? Dr. Neal, would you like to take this one?
Oh, I feel like all my answers are it depends. But it really it depends a lot on developmental age too. And I think a lot of times we have probably equal amount of kids who don't want any of their friends to know what happened, and other kids who kind of have no qualms about talking about it. And so I do try to talk with our kids about like what will be your little script that you have prepared for when you go back to school to talk to your friends or school classmates about where you've been and what happened to you. I think one of the biggest things to pay attention to is less psychosocial, but like more like executive functioning. But how do we manage once you go back to school, taking your medications in the morning and having a routine in the morning that promotes good medication adherence? And if you are going to go back to school and now you're back on the soccer team and you're feeling well enough to do that, how does practice in the afternoon impact medication in the evening and things like that? So there's a lot of logistics that come up with like reintegrating back into daily life. And then also with psychology or social work or with with their parents talking about what their script is, how they've made meaning out of their transplant so they can communicate that to their peers.
That makes perfect sense. It's a new normal.
Mhm.
All right, let's see. Our last question. I will open it up to the floor. Do you all see kids post-transplant regularly as part of the transplant team or as needed by family patient request? That's a great question.
Maybe we can all three touch on that since well, two of us are at the same institution, but I'm at a different place. I see every kid, our clinics are universal. So I see every child when they come back for all of their visits, their multidisciplinary clinic visits. And so I do a brief consult with social work at each of their clinic visits. And then if they need more, that seems primarily sort of transplant related, then I'll go ahead and see them in my other office for more traditional therapy. And then if they need more, but maybe it's about family of origin things or stuff that happened long before this that they're kind of still working through, or maybe they live in another community but want to be seen in person, then I would refer them to the community and I would collaborate with that therapist. But our physicians feel that it's important for all children to have sort of routine screenings. As, initially it'll be frequently because, you come to clinic a lot at first, and then it will be spaced out to 3 months and 6 months. So that's how it works here. And then I'll turn it over to the others.
I completely agree that kids and families should be followed closely and everybody should be seen and assessed by psychology. We have a very large kidney program here, so I wish I could say that I did the same and saw everybody at every clinic visit. It's not always possible, but I think that's something to absolutely strive for. A lot of times we try to see kids around the time of transplant and initially afterwards to do that initial assessment and see how families are doing and what supports might be needed. And then that might warrant closer follow-up for some kids at some points in time, and then closer at other points for other families. But really working within that multidisciplinary team to make sure the child, but also the family, is getting the care and support that they need throughout their transplant journey.
That's great.
Yeah, I was gonna say the same just quickly. Dr. Esposito and I are at the same place and we have large volumes. And so we sit in our transplant clinics and do try to see all of our patients and follow up. We're lucky that we also have a psychology intern and fellow this year. And so we kind of triplicated ourselves so they can see our patients as well. And I think also having a psychologist on your team helps your nurse practitioners, your PAs, and your MDs be more aware of psychosocial concerns. So even if we aren't in clinic, they might pick up on something and then let us know so that we can follow up on it afterwards if we weren't able to see them in clinic. And then I think Lauren or Dr. Esposito and I do the same thing where if it's a transplant related concern, we will refer to ourselves for ongoing therapy. If it's a more kind of general child clinical psychology concern like behavior, ADHD, depression that's not related to transplant in any way, then we would refer to the community for a therapist there.
So the key is definitely ask for help if you need it. It's very important that you keep asking until you get it. Well, I want to thank our panel for being with us today. This has been a great discussion, and I want to this is so important for families, and we're so thankful that you're here for us. If anyone didn't have questions answered, please pass them forward to us and we'll pass it forward to the team afterwards. Thank you so much for being with us today.
Thank you.
Thank you.
Bye, everyone.